The nursing science, as a scientific discipline, has progressed since the 1960s, and for nurses to accomplish their scientific works, one should comprehend the philosophy of science. This philosophy of science in nursing is not only relevant, but is very important to nurses' discipline and their professional routine. Nurses can perform their duties by thinking critically and by reflecting their values that concern to the care of their patients, and if a better understanding of philosophical perspectives is recognized. Let me briefly discuss the two different philosophical perspectives which are commonly known as rationalism and empiricism. Rationalism is a priori logic that uses deductive reasoning. This means that from a piece of general information, one would deduct to conclude. It's also termed as the theory-then-research approach. For example, according to research, all patients that have a fever show some signs like sweating, chills and shivering, headache, feeling weak, loss of appetite, and dehydration. Then, an 11-year-old kid was discovered to have a fever when tested with a thermometer. And with the use of rationalism or deductive reasoning, it could be inferred that the patient indicated symptoms like sweating, chills and shivering, headache, feeling weak, loss of appetite, and dehydration. This is an example of rationalism, since the conclusion is a specific case of the general assumption. For finality, deductive reasoning is based on what is known, and the conclusion represents something yet to be verified in clinical research. Moving on, the next philosophical perspective is empiricism. Empiricism is based on the idea that scientific knowledge can be derived only from sensory experience. Moreover, empiricism is inductive reasoning. This means that to arrive in a conclusion, one must first observe specific examples using the senses. It's also termed as the research-then-theory approach. For example, according to observations done from the past years, patients with fever have headaches. Therefore, in conclusion, all patients with fever have headaches. This argument is a type of inductive reasoning because, as you can see, it reached the conclusion by basing on the specific example. And it is important to remember that in this type of reasoning, an individual must not end the observation early or too soon to not deliver a faulty premature conclusion. Furthermore, although modern logical positivists believe that these two approaches would produce scientific knowledge, scientists of the early 20th century focused on empirical research. Empirical research is the research that depends on data obtained through observation or scientific data collection methods. However, scientists also emphasize that science is a process of continuing research rather than product focus on findings. Brown, 1977.